Vertusio, the shout-out app for industries, businesses, and services.
2021's emerging healthcare trends. COVID-19's legacy lingers long after 2021. Healthcare is perhaps the most affected industry by the worldwide epidemic. The healthcare business has changed to meet the increased demand for healthcare and the growing digitalization of protected health information. With rising COVID-19 immunization rates and things starting to open up, we felt it was a good moment to look back at the year's first half. Here are this year's top 10 trends. Flu cases decline, fears of a twindemic, a COVID-19 outbreak paired with a strong flu season, arose in 2020. Those suspicions proved unfounded. Our medical claims information shows that the 2020 to 2021 flu season was just 3.4% of the 2019 to 2020 flu season. We had slightly over 200,000 flu diagnoses this year compared to approximately 5 million in previous years. Social isolation, mask use, and a vigorous flu vaccine campaign helped reduce cases. Resumption of postponed care. COVID-19 pushed millions of people to postpone care. These treatment delays worsen symptoms and negatively impact patient outcomes. The good news is that patient volume looks to be recovering. The volume of procedure claims for screens for malignant neoplasms, cancerous tumors, was almost equal to the volume for the same time in 2019. The number of claims in March 2021 was 103% more than in March 2019, indicating more patients are returning for examinations. Our claims statistics show a similar pattern for diabetes tests. From September to December 2020, our claims data show that diabetes screening encounters exceeded 2019 volumes. Volumes for February and March 2021 topped 100% of 2019. Falling birth rates. The recent fall in the U.S. birth rate is one of the most startling phenomena. According to our medical claims database, pregnancy diagnosis claims fell 145% between 2016 to 2020. The COVID-19 pandemic is not only to account for the drop in birth rates. Our statistics show a decline in prenatal procedure claims since 2018. This looks to be a bigger trend, including numerous causes. Keep an eye on whether birth rates continue to fall or rise in the future years. Increasing mental health usage. COVID-19 puts a lot of individuals under stress. Anxiety and sadness rose throughout a year of social isolation, economic hardship, and uncertainty. According to our claims data, anxiety diagnoses increased roughly 13% in depression, over 4% in 2020. In addition to an increase in anxiety and depression diagnosis, there was a 13% increase in severe stress and adjustment disorders diagnoses from 2019 to 2020. But total claims for mental health drugs seem to have fallen from 2019 to 2020. This is hardly unexpected given the unprecedented worldwide pandemic's impact on mental health. But after Mental Health Awareness Month, it's encouraging to see individuals getting help, especially given how long society stigmatized mental illness. Care location shift. Another significant development is in how patients seek care. COVID-19 may not be full to a fault. When the epidemic arrived, healthcare was already seeking to relocate some care outside the hospital. Since 2016, hospitals' proportion of overall diagnostic and procedure claims has declined. During the same period, physician groups' share of total claims increased. Telehealth. COVID-19 accelerated the expansion of telehealth services, which shifted care sites. From March to April 2020, telehealth treatment claims were 5,000% more than in 2019. As things reopen, all eyes are on telehealth's future and possible legacy. The weekly telehealth visit volume has decreased marginally from 1.49 million in 2020 to 1.48 million in 2021. To find new markets for their virtual care solutions, healthcare software and IT businesses will need to monitor telemedicine demand closely. Remote patient monitoring. During the epidemic, RPM was also required. Providers might safely monitor chronic patients and treat them at home using RPM instruments, limiting their exposure to COVID-19 and without overloading the health system. RPM procedure claims data increased over 450% between 2019 to 2020. Like telehealth, it will be fascinating to watch if RPM maintains its appeal post-pandemic. Burnout in staffing. COVID-19 put a lot of load on doctors, nurses, and carers and worsened burnout. According to a Medscape poll on provider burnout, 42% of doctors are burnt out, and that percentage rises to above 50% for particular specialties, including critical care specialists and gender. Overwork is one component of physician burnout. On average, physical medicine and rehabilitation, hospitalists, and internal medicine doctors had the largest inpatient workloads in 2019 to 2020. Oncologists and hematologists had the largest outpatient claims per practitioner for the previous 3 years. Hospitals can hire more efficiently if they know which specializations are high demand. Increasing elective surgeries. Elective operations appear to be returning in numbers as COVID-19 rates fall and immunization rates rise. Our medical claim database shows that volume for knee, hip, and bariatric procedures has begun to return to normal. In fact, in March 2021, these 3 procedures outperformed March 2019. But we know demand has grown during the pandemic's months. With new patients needing elective treatments, providers will need to operate over capacity to accommodate pent-up demand. COVID-19's influence on obesity. Do you feel quarantine 15 during COVID-19 lockdowns? Not alone. According to a recent American Psychological Association poll, 61% of respondents have seen unwanted weight changes since the epidemic began. Obesity rates slowly rose in 2021, according to medical claims statistics. In Q1 2021, there were 2.12 million overweight and obese diagnoses each month, up from 1.97 million in 2020 and 2.05 million in 2019. As obesity diagnoses rise, many people seek medical nutrition therapy and behavioral counseling. From January to March 2021, average monthly procedure claims are up over 2%.
If you've enjoyed watching this video, then give this video a like and share with a friend. Also click on the subscribe button below to be notified as new videos are released.